The plight of Taiwan's psychiatric patients has come under the spotlight. After it emerged, dozens had died at one care institute in recent years, some in abnormal circumstances.
The poor treatment exposed at the institution reignited debate about the standard of care provided to people with mental illnesses. Today, let's take a look at a very different model of mental health care, which is based within the community and aims to re-empower people with mental health problems. Our Sunday special report.
Song Yo-cheng used to work as a high-flying manager for a technology company. Now he gets up at 6 each day and goes not to the office, but to his new lifeline, the Eden Clubhouse. Several years ago, he had an acute episode of bipolar disorder after a neurological operation. He quit his job and stayed at home, afraid to leave the house. Counselling and pharmaceutical drugs helped somewhat, but he still felt very insecure, until one day a social worker referred him to the Eden Clubhouse. Each day when the club's members, who all have various mental illnesses, arrive at the clubhouse, they have a morning meeting with the social workers at 8 to decide together what tasks need to be done that day and who will do what.
I'll take on the locker inspections today. It's very simple, but when you've done it, you feel like you've achieved something, and you feel like you're really alive, and that life has value.
Each club member chooses their job for the day, and then they get to it. The clubhouse provides a small world in which they can practice getting on with others and handling social relationships.
Since I came to the Eden Clubhouse, I feel like everyone is different somehow. Actually, everyone is unique.
The Eden Clubhouse is a mental health care service provided by the Eden Social Welfare Foundation for Taipei. It's based on the clubhouse model, in use in the United States for 60 years. Local community centers are jointly run by social workers and service users, allowing people with mental illnesses to develop their potential and discover their unique role in the community.
We
don't have a teacher or therapist relationship with the club members. We live here together, so we decide together what this place needs. So our relationship, the reversal of roles, what we're actually trying to do is to re-empower people with mental illnesses who have been disempowered in the past.
The Eden Clubhouse's core aim is to help service users regain autonomy in their lives while they receive treatment. That includes returning to live in the community and forming positive social relationships. For many in society, the biggest worry about people with mental illnesses is that they might be dangerous, which can lead to rejection of their mere presence. In 2016, the Taiwanese media exploded with a story of a man who was a common sight at National Chengchi University and known to students as Yao Yao Ge. One day, city authorities forcibly took him to a psychiatric hospital, despite having no evidence that he was a danger to himself or others. Some mental health service centers have even been the focus of protests by local communities. That's why the Eden Clubhouse took a very low profile when it moved into an alley in Taipei's busy Songshan District in 2012, not even putting a sign on their door until 2017.
We weren't sure what to do. We were often called crazies. So at first we were really low profile in this community. We didn't even put up a sign or write Eden Clubhouse, because we worried that people would search online and find out we were a mental health service center.
Government budget policies for mental health services only create more segregation. In 2012, 99% of NHI mental health funds were spent by hospitals on inpatients. Only 1% went to rehabilitation or support for service users to rebuild their lives within the community. This gross imbalance of funding effectively robs service users of the opportunity to build understanding in wider society.
The important thing about community support is that it addresses the loneliness of people with mental health problems. It tells them, I have value, I have a home, people value my presence, people care about me. Having this stability in their lives also cuts the cost of their medical care. It stops the endless cycle of going in and out of hospitals, which is, you get sick, you go to the hospital, you go home, but there's no community support. Life starts feeling hopeless. You think, What am I taking these meds for? Why on earth am I going to the doctor? My life is a big screw-up. I've got nothing to look forward to. No one cares about me. No one cares when I'm gone. They all just see me as a patient, a crazy.
Establishing positive relationships and integrating into a community is one of the most crucial needs of people with mental illness. In 2017, Yu-cheng was chosen as the first mental health service user to serve as a representative on the Taipei City Government's Disabled Rights Working Group.
These days, in lots of countries around the world, they have this clubhouse model to help people with mental illnesses. It's not like in the old days, when you'd have an episode, get sent to the hospital, and then when you were a bit better, you'd come home. And you'd just keep shuttling back and forth between home and hospital without any other support from outside.
I think that mental illness reflects an imbalance in society. If we only look at biological factors and we don't see society, what society is doing to people's minds, then we won't know why society is changing.
Modern society is spawning more and more mental illness, but movements like the Eden Clubhouse, which offer support, respect and acceptance in the community, can be one stepping stone on the path to autonomy and social integration for people who struggle with their mental health.